Hello everybody, I am Dr. Sarah Wooten. I am a small animal veterinarian, and in this video I am going to be teaching you everything you need to know about feline asthma. So feline asthma is a disease of the lower airways. So the bronchioles, the smaller bronchi, the air tubes that bring the air from the nose down into the lungs, that's where this disease resides. And in cats, it causes coughing and shortness of breath. And it affects about 5% of our feline population. So not very many, but enough to where we actually need to pay attention. Most veterinarians, including myself, believe that feline asthma is caused by an allergic reaction to something that the cat breathes in. However, feline asthma is still under investigation, and we haven't completely worked out all of the bugs per se as to what the causes are. But the majority of us do believe that it is due to an allergic reaction. The gist in feline asthma is when the cat inhales something that they are allergic to, so they have formed an immune response to that, the immune system reacts. It says, oh my God, invader, invader, and it creates inflammation, and inflammatory cells develop in the airways that cause more inflammation. The airways swell shut and the cat starts to cough, which can cause more inflammation, and it creates this vicious cycle that results in the symptoms we associate with feline asthma attacks. So allergies are thought to be the main cause of feline asthma. If a cat is sensitive to certain allergens, anything, right? The immune system releases these chemical messengers that cause the inflammation in the airways. And in response, these airways become really tight and they cause the difficulty in breathing. So allergens can also irritate the lining of cats' airways, which can contribute to an additional disease called bronchitis. So what can cats be allergic to? Well, lots. One of the main causes of feline asthma we have found is smoke. So smoke from smoking, tobacco smoke, and fireplace smoke, and candle smoke even. So any kind of smoke can really cause these cats to have a lot of problems breathing. But there's other things. Aerosol sprays like hairspray or Febreze, or basically anything that comes out of a can that you spray and can aerosolize into the air, can cause the symptoms of asthma. Some household cleaners that off-gas a lot. Some cats are sensitive to bleach, some cats are sensitive to ammonia and can go into an asthma attack if these cleaners are used around them. Dusty kitty litter can be a problem for some cats. And so when you pour out the litter, you'll notice sometimes there's a poof of like dust that comes up out of it. Well, that can be an irritant for some cats that have asthma. Pollen. Right? So we know of pollen as humans as it causes all the symptoms of hay fever in us, but it can also cause problems with our cats. Not only the signs of feline asthma, but it can also cause itchy skin. Isn't that interesting? So they can be allergic to both tree pollens and grass pollens. Dust mites are another cause of allergens, and mold and mildew and mold mites can all cause allergy flare-ups that result in asthma. And then even scented candles, even if you don't have very much smoke, but you're using a scented candle or you're diffusing essential oils in your house, while we as humans love the smell of the stuff, sometimes it's really hard on our cats if they have problems with feline asthma. It can even be hard on them anyways. And even certain foods can cause an asthma attack. So the most common proteins: beef, chicken, eggs, pork, soy, those can be a trigger for some cats to develop feline asthma symptoms. As a side note, cats that have food allergies and feline asthma associated with it, they often will have gastrointestinal symptoms and skin symptoms as well. So they may have feline asthma, but they also may have problems with loose stool or vomiting or excessive gas, or maybe they have itchy skin. You know, those are all signs that there's something going on with the food allergen. In addition to all of those things like internal parasites, severe stress, severe heat, heart conditions, and obesity and heartworm disease, yes, That is a thing in cats, and undiagnosed pneumonia can all make the symptoms of asthma much, much worse. Okay, now that you know what can cause feline asthma, let's talk about what it looks like in cats. Just like in humans, cats with asthma will have a range of severity and symptoms, and they don't happen all the time. So coughing and wheezing are obviously some of the more common signs in cats. And cats don't often cough, right? So if they are coughing, there's something going on and you got to pay attention. They might look like they're trying to bring up a hairball. They might cough and then have like a retch afterwards. Sometimes they may cough and then vomit up some clear liquid because they're coughing so hard. So coughing is a major sign. Obviously, it doesn't happen all the time, right? Because they have to come into contact with whatever is causing their airways to constrict down. If they're in the middle of an asthma attack and they can't breathe very well, you may hear actual wheezing sounds when they breathe. And oftentimes they'll squat down on their elbows like this with their head and neck extended out front. Sometimes they have half closed eyes and they're breathing and it's really, really hard for them to breathe. And they do that because that's the most easy position for them to be able to take a breath. Sometimes just breathing rapidly can be a sign that there's something going on too. So if your cat is resting, sleeping, dozing, and they're breathing more than 40 breaths per minute, that is a sign that there's something going on there, okay? If they're acting tired and weak, or they don't want to eat, or they just can't get comfortable, or sometimes if you look at their gums, they can look very pale, or sometimes they can even look blue. Those are all signs of an asthma attack. So if you see these symptoms in your cat, you have to talk to a veterinarian as soon as possible. And I know it can be really challenging to get in to see a veterinarian, but one way to be able to get in to see them is just to say, I think my cat might have difficulty breathing, my cat might have asthma, and I'm concerned that my cat may not be able to breathe. And most veterinary hospitals, even if they're booked up solid, will get you somewhere immediately so that they can stick that cat in an oxygen cage and help it breathe more quickly. Okay, so don't be afraid to stress the emergency of the situation, right? I mean, if you're saying, my cat's coughing, but it seems okay, you may not get seen that day. You kind of need to push the issue a little bit. So let's talk about how, once you are at the veterinarian, how we diagnose feline asthma, okay? So if your cat has the symptoms associated with asthma, get your cat in to see the veterinarian, hopefully as soon as possible, because cats that have the signs of feline asthma don't have them all the time. So it's really important to get that cat seen when they're actually having an asthma attack. It's helpful to us if you keep a record of when you notice the symptoms developing and what type of symptoms affect your cat. Even better if you can take a video of your cat on your smartphone when you think they're having an asthma attack and then bring that and show it to your vet. That's worth its weight in gold, because that can tell us so much information. Also, write down what food or foods you feed your cat, what type of kitty litter, and what kind of products that you're using in the house that could cause any kind of triggers, okay? Your veterinarian will ask you a complete health history and do a physical exam, which includes listening to your cat's lungs and their hearts. They are going to want to take radiographs. You call them x-rays, but they really are radiographs. And they may want to run some lab tests. If they want to run these tests, let them run the tests. This is important information for them to be able to build the idea of what is going on with your cat so they can help your cat. The tricky thing about feline asthma is that sometimes it looks like other diseases, like heart failure or lungworms. So your veterinarian is going to need these tests, which could include allergy tests and bronchoscopy, scoping the lungs as well. So if you are cost conscious, many of us are, there's no shame in that, I recommend starting with radiographs. Get some x-rays of your cat's chest. Get some blood work, including a heartworm test, depending on where you live, because heartworm is transmitted by mosquitoes and it may not be everywhere geographically. But if it's in your area, you want to get your cat tested. And then also run fecal tests, because again, intestinal parasites are super common, and it could be an intestinal parasite that has accidentally migrated to the lungs and is causing problems. Yes, they do that. Those intestinal parasites can be very disobedient and they don't often stay where they're supposed to stay. Then depending on what the veterinarian finds, if they need to run additional tests, then you can make that decision. Okay. A lot of times veterinarians will come in and they will give you what we call in the industry, the gold standard. The gold standard is all the things you would like to do so you can get the most information and provide the best treatment possible. Sometimes we have cost limitations. And so if your veterinarian comes in with a big, long estimate of all the things they need to do, and you are blown away by the number that they give you, sometimes it has a comma in it as far as the cost, don't hesitate or feel ashamed or anything to say, I don't really have the budget for that quite yet. Can we start with x-rays, blood work, and a fecal test? Okay. And your veterinarian gets it. We know that not everybody's made of money, basically. And so find somebody who will work with you. So one caveat, feline asthma can be very difficult to diagnose because unless your cat is having an active attack at the time of the x-rays, radiographs, the films can come back as totally normal, which is really frustrating to veterinarians as it is to you. It's really frustrating when you're like, oh, of course, this is a feline asthma case. I'll take x-rays. I'm going to see what I want to see. And then you take the x-rays and they look totally normal. And you're like, well, I just spent, $150 to look at normal x-rays. So if that's the case, sometimes veterinarians have to treat a cat based on what you tell them or what they see in the video, because sometimes they don't get the answers from their tests. So come prepared with all your information and expect sometimes that the x-rays can come back normal. It doesn't happen all the time, but I just want to prepare you in case it does happen, because it's happened to me. Okay, so let's talk about treatment. First, the bad news. There's no cure for asthma. Wah, wah. Now, the good news, it can be successfully managed. Yay! So the way to manage, there's lots of ways to manage feline asthma. The most likely way is that your veterinarian is going to prescribe some medication to you to reduce the inflammation. The most common one prescribed is steroids, corticosteroids, because they reduce the inflammation. They may also prescribe a bronchodilator to help open airways. Treatments can be oral, through the mouth. You give the cat an oral pill. It can be injectable. It can be something that your veterinarian injects that's long lasting at the veterinary hospital, or it can be administered through an inhalant device. Yes, cats can be trained to use inhalers. They look a little different than human inhalers, but once the cats realize when they put that thing on, then they suddenly feel better. Most cats, if they need to get inhalant medications, they're actually pretty good at it, right? So there's other ways for you to prevent feline asthma or alleviate asthma-like symptoms in your cat. I have a whole list for you, okay? Number one, please, 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 please make sure your cat is at a healthy weight. Not a mega chonker. No mega chonkers, right? Because that is just so bad for their health. Remember, obesity predisposes cats to asthma. So if you're not sure if your cat's at a healthy weight, you can ask your veterinarian. Alternatively, I love the hand test. So if you feel your cat's ribs right behind their front legs, if their ribs feel like this, then they are at a healthy weight. If their ribs feel like this, they are too fat. If they feel or look like this, like your knuckles, then too thin, right? But the best thing is to talk to your veterinarian. So make sure your cat is at a healthy weight. That will go a long way. Next, reduce stress, because stress, as we know in humans, makes asthma symptoms worse. It's the same in cats. I don't have time on this video to go into how to reduce stress in cats, but I do have another video all about how to reduce stress in cats. Next, remove allergens from the environment as much as possible. There's lots of ways to do this. So get a low dust kitty litter. That should be number one for all asthmatic cats, low dust kitty litter. Avoid aerosolized cleaners and deodorizers. Anything you're spraying, try to avoid it because it just poofs up into the air and then your cat's going to have problems. If you have to use those, try and put your cat in a different part of the house and open the windows so things can clear out. Avoid heavily scented household cleaners. Stop smoking. That's good for you anyways, right? Stop smoking around your cat, or decrease the use of a fireplace, a wood smoke fireplace, or candles, since any smoke can be an irritant. Stop using essential oil diffusers. I know they smell so good. I love them myself, but if you have an asthmatic cat, it's not a good idea. For their bedding, you can actually get covers for their bedding that are hypoallergenic, that help reduce dust in their bedding. Use a HEPA filter in your furnace AC unit and in your vacuum cleaner. And when you do vacuum, make sure your cat is in another part of the house. And I would vacuum frequently, like once a week, to keep your dust levels down. And then during pollen season, keep your cat indoors. So there are other treatments that might help that are natural or alternative treatments. So for some cats, having them tested for allergens or having them tested for allergies with a skin test, or less, I don't like the blood tests as much. The skin tests are more expensive and do require sedation, but they're usually only administered by specialists. Those are the drawbacks to the skin tests, but they're way more accurate. And then have your cat tested during the season that they are asthmatic, because if your cat is only allergic to a certain kind of pollen, if you test your cat in the other part of the year, it's going to come back as negative. So you have to test the cat when they're actually having problems. The reason for testing the cat is that you can have allergy serum made up and then have your cat get a series of allergy shots that in theory can desensitize your cat to the allergen. It can desensitize the immune system to that particular allergen. Doesn't always work, but it's worth a discussion with your veterinarian to see if it's an option for your cat. Number 2, omega-3 fatty acids from fish oil. I love fish oil. It's so good for so many things. And since asthma is an inflammatory disease, giving them something that's anti-inflammatory like fish oil can potentially reduce symptoms. It hasn't been totally shown in cats, but for some cats it provides benefit. So fish oil supplementation daily, and you talk to your veterinarian about a dose, because it's much higher than is in most cat foods. Number 3, if there's a suspicion that your cat has a food allergy, then you can talk to your veterinarian about putting your cat on a novel protein or a limited protein diet or hypoallergenic food for 6 to 8 weeks. That is enough time to see if that will help. Now remember, cats that have food allergies typically have gastrointestinal and skin signs as well. So don't do this unless you and your vet are actually suspicious of a food allergy. Okay, couple of last thoughts. If your cat has already been diagnosed with asthma, seek medical attention early when symptoms develop. It will help avoid more serious problems. And use the prescribed medications as directed. And if you have any questions, talk to your vet. If you're having a hard time getting the pill into your cat, talk to your vet. There are lots of really fun ways we can get pills into cats that are much more palatable than sticking your finger in their little tiny mouth and shoving it down there. It can be compounded into delicious liquids or transdermal lotions that you rub on the ears or chews or, whatever, right? Lots of options. If you're running into a problem, don't hesitate to reach out. So that's all I have on feline asthma. Now you know what it looks like. Now you know what it causes it. Now you know how to treat it. Now you know how to prevent it. So I hope this information has been helpful. You never know, it might help save a cat's life. So if it's been helpful to you, please let me know in the comment section. If you like this video, share it with your friends. If you have something you'd like me to talk about, leave it in the comment section. And if you like these videos and you like learning about your cat's health, subscribe and come hang out with me regularly. Thank you so much for watching. I am Dr. Sarah Wooten, and I will be back soon with more health topics for you.